An outbreak of Ebola in the Democratic Republic of Congo has been declared as a public health emergency of international concern by the World Health Organization. At least 80 people are thought to have died in the east of the country, many of them in Ituri province across the three areas that you can see. A first case has also now been confirmed in the city of Goma, close to the border with Rwanda. Neighbouring Uganda has also seen one case. Yesterday, a man died of the virus in Kampala. We'll be looking at why the outbreak has become a global concern, but first, Joe Inwood reports.
In Bunia, they are all too familiar with what this means. The re-emergence of Ebola, the deadly virus that has struck the eastern DRC before. It's said to be spreading and has already killed more than 80 people. Local hospitals have been doing what they can, but they are not equipped to deal with a major outbreak. The news that a case has been reported in Goma, the biggest city in the region, is of particular concern. Containing the virus before it spreads is vital.
I'm afraid, like any human being, because we have children at school and they still come into contact with a lot of people. We don't really know who they might be around or play with. Once they come home, they can infect the whole family.
This was the same region that was hit by the DRC's deadliest ever Ebola outbreak between 2018 and 2020. That killed around 2,500 people. Specialist treatment centres were set up, with patients kept behind plastic sheets. Ebola spreads through direct contact with bodily fluids and through broken skin. It causes severe bleeding and organ failure, and often an agonising death. In one of the poorest countries on earth, where many do not have access to good health care, bringing this latest outbreak under control comes with many challenges.
People in the community said it was witchcraft. Now we realise that the first person fell ill in late April and died. The body was repatriated to a nearby town. It was the return of this body to a mining area with a large population that caused the Ebola outbreak to escalate.
The strain of Ebola behind this new outbreak does not have a vaccine. The World Health Organization says the DRC is facing a health emergency of international concern. Joe Inwood, BBC News.
So how big a threat is Ebola, and should we be worried here? Here's our health correspondent, James Gallagher. James.
Well, Rita, Ebola is a rare but deadly virus, and what we're dealing with here is a species of Ebola that's not been seen for over a decade. It's called Bundibugyo, and it's only caused two outbreaks before, one in 2007 in Uganda and one in 2012 in DRC. It killed around a third of those infected. Symptoms start like flu, with a fever and tiredness, progressing to vomiting, diarrhoea and organ failure. Some patients develop internal and external bleeding, and this old, rare species is a challenge. Tests on patients were coming back negative because they were looking for more common types of Ebola, and there's no vaccine that's been developed. And that means there are fewer tools to stop this outbreak, and there are no drugs that target the virus, making it harder to treat. And there are yet more complications. The first known case, a nurse, developed symptoms on the 24th of April. So there's been weeks of the virus spreading, and the true size of the outbreak is unknown. It's also happening in a conflict zone with 250,000 people displaced from their homes. So experts say stopping this outbreak will be a challenge.
This is an emergent strain that hasn't been seen for some time, and there's no vaccine. So huge effort to get some vaccines tested and out there is the priority. The second is where this is happening. These are really hard to reach areas, mining towns, on borders, really vulnerable communities.
Experts are haunted by this. The outbreak of Ebola that started in 2014 in West Africa and affected 28,600 people. The risk Ebola poses to the whole world remains tiny. Even back then, there were only 3 cases in the UK, and all were healthcare workers who had volunteered to help. DR Congo has dealt with more than a dozen outbreaks of Ebola in the past, so it has the experience. But whether this outbreak is rapidly contained or spirals will be determined by the response in the coming days.